Alex, we just wait and hang out.
Good afternoon and welcome to our Facebook Live event focused on kidney transplant and living donation. We are in a new year, and for those who are in need of a kidney transplant, now is a great time to start or to perhaps invigorate your search for a living donor and finding a new to you kidney. For those of you who have a loved one in need of a kidney transplant, now is the time to become a living donor champion and help your loved one in their search. My name is Alexandra Radomsky, and I am a clinical social worker at MedStar Georgetown Transplant Institute. Today, we will be hearing from experts in the field about transplant facts, as well as ways to aid in the search for a living donor, including the role that social media can play. I'm joined today by transplant nephrologist, Dr. Beje Thomas, and he's going to be answering some of the more frequently asked questions about kidney transplant and about living donation. We're also joined by Sarah Ridenour, a social media specialist at MedStar Health. Because this is a live and interactive event, we encourage you to enter your questions on the event page, which Sarah will be monitoring. We'll take the time to answer these questions toward the end of today's event. We also hope to be joined by Mr. Kenneth Hunter, who is a recipient of a living donor kidney. As is the nature of a live event, sometimes things come up, and Mr. Hunter has had something come up in his schedule that was a bit unexpected. So we hope that he'll be able to pop onto the call later on. His story, however, is also featured in one of our MedStar brochures, and a link to this brochure will be in the comments below. So feel free to take a look at that and learn more about Mr. Hunter's story and his transplant. So before we get started, we'd also like to encourage our viewers to like and to share this post to extend its reach to others who may find it helpful. And to begin, Dr. Thomas, we'd like it if you could tell us some more about kidney transplant. So specifically, how many people are currently in need of a kidney transplant, and how long is the wait for that?
Thank you, Alex, for the kind introduction. So first of all, who is eligible for a kidney transplant? Your kidney function roughly has to be at 20% or less. We do something called the estimated glomerular filtration rate, or the eGFR. That's the fancy words we use in medicine. But when your doctor talks to you, when they tell you that your kidney function is about 20% or less, you can be listed for a kidney transplant. Roughly on the list, there's 100,000 or so people waiting for a kidney transplant. And depending on your blood type, it depends how long you wait if you're going for a deceased donor kidney. So there can be wait times as long as 8 or 9 years, actually, depending on where you're located. Obviously, if you're very fortunate and you have a particular blood type that you're going to call the universal recipient, the wait time can be much less. That's why it's so important to really try to look for a living donor, because you can go from that 8 years to really 4 to 6 weeks if you have a living donor that's passable. So how fast do we do a living donor transplant? If you needed a kidney and you had a living donor, both of you have passed all your testing and are accepted, we really can do the transplant in a few weeks. And that's as compared to you waiting 8 years. And remember, during that 8 years on dialysis, you can have potential complications of dialysis and such. And that's what we're trying to avoid. And really super ideally is, of course, if you can get that transplant before you ever touch dialysis. So in summary, there is about 100,000 people on the wait list, depending on your blood type and other things, but mostly your blood type depends on wait time can be long. Really, on average, if you take all the blood types, it's somewhere between 4 to 8 years. So it's a significant amount of time. And that's why we really push for living donors. We don't say, do you have one? We ask, like, are you looking for one? These are the kinds of questions we ask for.
Okay. Well, that's helpful to know. I think perhaps something else that people are wondering about are the other benefits to living donation. So obviously it cuts down on the wait time, and it could prevent someone from needing dialysis or having complications of prolonged dialysis. Are there other benefits to living donor transplant versus deceased donor transplant?
So for the recipient who gets the kidney, the huge advantage is, number one, of course, speed of the transplant, getting it quicker. But number two is you get an organ from a healthy person that will work immediately post-transplant. And so you'll come off dialysis or you'll come off this stuff, whatever modality you might be on. Remember, on average, if you take all the kidney transplants we do from someone who's passed away, almost a third of them, 30%, still need some dialysis after the transplant. We call that delayed function of that kidney transplant. And that's important to know. So the living donor, the other advantage is you get a kidney quickly, but it also works very quickly. The other major advantage, of course, is now that the kidney is from a healthy person as opposed to someone who might have had diabetes or hypertension and they passed away and you have that kidney, is that these kidneys tend to last longer and have more function for a longer amount of time.
Okay, thank you for that. So you had mentioned that living donation is a way to reduce the wait time for transplant. If a patient is able to identify a living donor, how long typically do they wait until the actual surgery?
So a couple questions to add to that, or a couple comments to add to that. So the decision, so when someone has a living donor, first of all, we have an online questionnaire, they fill it out. It has to be, of course, voluntary. And really what I tell the patients is when you're looking for a living donor, they have to have a sound mind, of course, sound body, and they have to be, of course, age. They can't be below 18 years old. And we don't really have an upper age limit cutoff, though, it's unlikely we're going to take a 90-year-old to be a living donor. But they fill out that questionnaire on their own volition, and then let us do the screening. Of course, if someone has hypertension or diabetes, they probably might not qualify, but don't worry about that. So whoever wants to fill out that paper, that questionnaire, we will do the medical screening. Another important point is don't worry about the blood type. Don't even say what the blood type is. Why? Because with the match program, where we have this exchange program, as long as you have the healthy donor, we can put you into a computer system to find somebody else that might be able to exchange a kidney with you. So in a sense, like trading in sports. So they have someone who they're not a match for a blood type, that person give you a kidney, and your person can give them a kidney. And really, when you do living donation, remember, it doesn't only help you. Now there's one less person on the list. So you're actually helping the group of everybody. So if you have more living donations, it actually helps other people get a transplant faster as well. So it's really helpful in many ways. The surgery itself is really dependent on the donor. So the donor really, because they're doing the gift, they're giving you a gift, they decide when the transplant is. So if someone is going away to work, someone has to take a trip, whatever it may be. If someone's a teacher, they want to wait till summer, then we let them decide. And they decide when we do the transplant. And another important thing to note is, as your living donors get worked up, they actually do not have to tell the potential recipient they're being worked up. If they want to do it, on their own and not tell anybody because they're scared of the recipient will feel bad if they don't qualify or something like that, they don't have to tell them until they're in. So one of the stories that you mentioned is there are two sorority sisters, and one sorority sister knew she was getting a transplant on a Friday, and she didn't know who the donor was. So her other sorority sister, they've been friends for many years, they go to lunch about 2 or 3 days before, and she's like, oh, by the way, I'm going to be your donor. And that's how she found out. But it takes a lot of pressure off the donor.
Mm-hmm. Mm-hmm. No, that's very important. So you mentioned in answering that, one example of a donor recipient pair who were sorority sisters.
Right.
One of the questions I think that we've gotten from patients previously is, have recipients really found a donor through, their personal trainer, through a German Shepherd rescue group, by wearing a t-shirt at Disney, by being in a band, playing kickball? Are those all things that happen?
Yes. So when I did I finished my training in Charleston, South Carolina at the Medical University of South Carolina. We went to a kidney walk, and there was a lady there who wore a t-shirt saying, I need a kidney. One of the EMT people that came that day to the walk actually donated to her a few months later. So these things are real stories. It really happens. Because there are a lot of people that want to do good, and this is one way for them to do it, particularly in our present times. For the donor, we're talking a lot about the recipient. The donor, of course, you medically really screen them very well. Do all the testing. The testing is paid for by the recipient's insurance. So basically, you get a free full physical exam. Some of the other things to mention is for the donors, we have a particular program at Georgetown called Donor Shield, which can help pay for their stipend, help pay for their travel, and these other things, as well as we follow the donor. We in-person visits or virtual visits, I guess now, for a short time thereafter. But we are always here available for the donor long term. If someone donates a kidney and they unfortunately for some reason end up with significant kidney disease and they themselves need a kidney transplant, they will shoot to near the top of the list where they'll get transplanted in a few months. And that's one of the other safety nets for people that donate.
That's really very good to know. Thank you for that. So there are, as we just talked about, several ways that folks have been able to find a living donor. As I mentioned at the beginning, we're hoping that we will be hearing from a patient about his personal story in looking for a living donor and how he was able to find a living donor. But what other ways can we sort of encourage patients to aid in their search? How do we advise people who want to look for a living donor?
So the one truism is if you don't look, you're not going to find anybody.
Mm-hmm.
So part of it is psychologically coming to the being okay asking. So, there is a lot of material out there. There's material from the National Kidney Foundation. If you Google the Big Ask, B-I-G-A-S-K, Big Give, B-I-G-G-I-V-E, they actually have a full PDF on how to approach people and how to ask. It's a very personal decision. So one, yes, you can do word of mouth, where you can just ask your friends and your family, people you know. But the advantage of social media is your circle goes from this to this. So and that's how you hear the stories of people getting transplanted from Disney, from someone from another state, right? So so social media is very useful. Some people have podcasts, some individuals have, they use Instagram, Facebook, YouTube, whatever it may be. And it doesn't always work, but it's just putting yourself out there. So the social media outlet is one. Also your own family and friends. Some of the things that we discuss on our other Facebook Lives is, number one, again, don't mention blood type. Just kind of give your story and say, and have a link to a questionnaire, whether it's our transplant center, another transplant center, whatever it may be, but just have a link they can click on it, they can go from there. And again, they can do it anonymously where they don't have to tell you. And the advantage of the link also is they can do it after work or whenever they want on the weekend, or et cetera, et cetera. So you can use different platforms and you can do that. The other thing people do is also, even if you go to let's say church, if you have a church flyer, you can put your information there. If you want to be private, you can say just talk to the deacon or the reverend or whatever it may be, that they can approach them and then they can connect you with them. So those are different ways that people do it. You already mentioned the T-shirt way, so that is another way. And we are not going to take donors that we think are unhealthy. So we're not going to take anybody just to take kidney. Only if the majority of our donors do not, people that come forward, they actually get turned down because we feel they're not healthy enough. So that's really important to know, that we don't just take anybody to give you to donate a kidney. But yeah, so there are those several platforms. What have the patients told? So the blood type thing I mentioned. The other thing I do want to mention is you need to be able, if you want to be contacted. So one of our patients, I think, actually had a landline dedicated only for that kind of phone call. And the other part is, if you are a private person, you don't want anybody to know that it's you. You can use an alias on your face. And I would recommend making a totally separate Facebook account or Instagram account that is just geared towards kidney transplant. If you want to keep your privacy and you don't want everybody to know, patients have found that much easier to do, even if they're not concerned about privacy, just because it's more organized, that you can keep this part of your life there and separate from your personal life. Alex, have you heard anything similar? Like, what have the patients told you?
Yeah, thanks for asking. I actually do have a patient in mind who she's got a pretty incredible campaign that she's been able to create in her search for a living donor. She, even gave it sort of a clever name. She calls it "That Girl Needs a Kidney," and she
has
a face. You remember? Yeah. She's actually been on one of our live events before, talking about her experience and doing that and building that. And she's just committed, to getting her story out, which I think, as you mentioned, is one of the most important parts of this, is sharing that information. Sharing your story, I think, is how we sort of present it to patients when they're asking. And she's got a Facebook page. I believe she might be on Instagram. She makes YouTube videos.
Right,
she
and
shares it.
A lot of the stuff that patients put on there is it's sharing their story. So as a community, it's not just actually, I need a kidney. They actually put some educational material on there for other patients, other resources for other patients. So as you make your social media website, you can actually just share information that you have with others, from whatever resources that you found, from, a low potassium diet to, how you feel when you're on dialysis. I have to say one more story. This is from South Carolina. A mother actually put the story of her son on her car. Like she wrote the whole story around the back of the car, and they went to Walmart and found her donor at Walmart.
Oh my goodness! Wow.
And just to show you, the South is, there as we have a lot of racial issues in the last year. It was actually a Caucasian donor for an African American man, and she worked at Walmart and saw the van and went and talked to the mother about it, and that's how it happened.
Yeah, it's amazing. It's really amazing. It just takes sort of one person seeing that who wants to, or who feels called to
Right.
donate, and that's
Right.
how it can really get started.
And a lot of people will just also, it's not just that you're looking, other people will take you and hashtag living
Hmm.
donation, or they'll tag you, and then your story will go up, in many more places. So again, remember that circle goes from here, which is just our friends and family that you talk to on an everyday basis, to a much larger circle that you can reach out to.
Hmm. Hmm. I
And
think that also, oh, I'm sorry.
or nope, I was just gonna say, and in the time of Zoom and COVID, we actually, if your living donor actually candidate lives far away, let's say California, we don't make them come in. They can actually do the evaluation through Zoom. They can do their labs and work up locally.
Yeah, that's helpful for a lot of people who don't live
Right,
in the DC area for sure.
right.
That's great. Yeah, I think everybody, not everybody, but a lot of people are much more active on these virtual platforms now than maybe they were previously. We're all kind of used to doing these Zoom things, and
Mhm.
um, I've heard some suggestions where if you're having a virtual church event or a virtual, reunion or work
Oh
event, that
yes.
those are also places you could share your story, and your reach would be a bit bigger because perhaps people are joining virtually who may not have come in person. So it's just another opportunity to share that information to a wider circle.
I had a patient who wore a sandwich board, so they had a board here and then on the back, and as my wife needs a kidney. And that patient had a record number of people. He walked up and down Greenville, South Carolina,
Oh my
and
gosh.
he had there were 100 or so people that called the center to try to donate. So there's all
Hmm.
types of ways. That gentleman did that, and that was maybe 10 years ago. But the thing is, he had the initiative to do it, and I think as much as we're scared to ask others,
Yeah.
if you want to really help the system, remember, it's not just you that you get help. You actually help people on the list, because now they are quote unquote moving up the list, because and have more access to transplant, because of a huge portion of patients were able to get a living donation. We
Hmm.
did over 100 living donors last year in the 2020
Hmm.
area, despite COVID.
Yeah, right. That's an incredible point to make. And you also make a really good point about a person's spouse or person's family member helping them search. I think we actually call those living donor champions. So
Right.
if a patient is maybe a little bit uncomfortable with sharing their story personally,
Mhm.
they can ask or have a volunteer from their friend or family group to do that for them, right? With their permission, of course. But to be the one to actually go sort of hit the streets or hit the
Or
Facebook
even,
page.
now there are tools to make web pages, and
Mm.
a lot of the people that are savvier with tech can do things
Mhm.
for you and set it up for you.
Mhm.
That brings me to an important point at Georgetown. There's something called the Microsites.
Mhm.
So it is on our webpage. So Microsites is, we actually help the patient make a website for them to get a living donor. And it's free service, there's no cost. You just have to contact us and say, like, this is something that I want to do. Can you tell me more about it?
Mhm. That's great to bring up. I get that question a lot. If we can sort of help a patient to do these things, or how can we help a patient to do these things? So the microsite, that's essentially a small website, right? That just shares that person's individual story.
Correct. Right. You had a patient email me the last time, and that's what
Yes.
we ended up
Hmm.
being able to connect them with the part of the team that takes care of that, and
Hmm.
and they were able to hopefully set everything up.
That's great.
And
Yeah.
again, it's community, right? It's, you feel like people have got your back. They're trying to support you. You're not out there alone on dialysis, or suffering from kidney disease alone.
Right. Well, and as you have sort of demonstrated, because we know about a lot of these examples that have been successful, we have things, that we can suggest to other patients that they can try. So we would obviously encourage patients to come to us and ask us for those suggestions, and we're happy to provide guidance and even some materials to take a look at, to help them
Right.
with
I
that.
mean, majority of people don't even know they have kidney disease. Remember that. A lot of people are not tested, or they don't follow their doctors. But and then if you don't know, then definitely the person next to you doesn't know. So sometimes
Mhm.
and not everybody's on dialysis where it's very obvious. So they might have kidney function 20%. They find out, they go to get their labs done, life insurance, whatever it may be, but no one else knows, because they're totally fine. They have no symptoms.
Mm, that's good to remember as well. I'd like to stop briefly and just sort of welcome anybody who is just tuning in to our Facebook Live event. We're here today focused on kidney transplant and living donation. And I've just been discussing with Dr. Thomas, who is a transplant nephrologist, about the benefits of living donation and also how folks can sort of search for a potential living donor for their kidney transplant. So we've talked about different ways that people can try to share their story, including the role of social media, which is extremely popular and helpful right now. Dr. Thomas, I was hoping maybe you could talk a little bit more about what you mentioned earlier in terms of the protections or the things that MedStar Georgetown can provide to living kidney donors who do decide to donate with our center.
So, so as someone gets evaluated, the first medically, so what's the process actually? So you come in for the donation. So in the time of COVID, you go to a COVID-19 free floor. You're tested before, obviously, and then our transplant floor is COVID free. So there are no patients with COVID on the floor, and there are all strict precautions kept in place, even to the point that we still don't allow visitors onto our transplant floor, even though other parts of the hospital have visitors. So in our transplant floor, you're not allowed to have visitors. So I guess the donor and the recipient are the only visitors for each other during that time. So after the transplant is done, typically a donor surgery takes about 2 to 3 hours. The donor comes back to the to the floor, and they're usually majority of the time out of the hospital actually within 24 hours. We usually round in the morning and see the patient, the donor, in the recipient's room hanging out the next day. So the far away majority of patients go home the next day. We ask them to take it easy for about several weeks. After the donation, we do follow them for about 1 to 2 weeks after in virtually or in person, just to take the scar and everything, and they can they go home, and then we check their labs every 6 months for up to 2 years, and of course we follow them long term after that, and they can always call us with questions. They do get something with a donor shield that's specific to Georgetown because we're in the National Kidney Registry, and that is, again, to some degree, support if they to support if they have to take time off from work, support for travel, and I think also support for life insurance potentially. So these are some of that's what we call the donor shield, to protect the donor from any of those issues that they might have that might prevent them from donating. So those are the major things that I can think of. And of course, access to the transplant center. So if they have a question and they're 5 years from their donation, the patient still can call us. So that is key. And then we walk them through whatever they make walk through. As far as insurance and those kinds of things post, the social workers in a way know much more than I do about that, but it's before with presently, kidney donation is not what you would call a pre-existing condition that insurance can turn you down for. Am I right in saying that, Alex?
I believe that's true, yes.
And that's also another important point to make. The other thing generally that I tell the donors when they come to see us is, they don't lose half their kidney function. They actually lose less than half. So you might lose about 20 to 40%, but we make sure they will have that we take our best medical decision to make sure they will live their life without needing dialysis or having major kidney issues. And another common question that I get, I know you didn't specifically ask this, but what about pregnancy after donation in females that are of that age? So yes, there is a small increase in there's increased risk of potentially hypertension in the pregnancy, but we've had many of our living donor patients have kids, and they did very well. So there's some immediate, like more financial and those kinds of things, but of course there's other medical things that we discuss at the meeting and afterwards.
Okay, yeah, those are all important to know. And what I'm hearing is that safety is obviously a huge priority for us, that we want to make sure that this is an incredibly safe process for the donor and also for the recipient. Right. So we take that very, very seriously.
Right, and you meet with a social worker, you meet with a finance person, you meet with the patient advocate, a surgeon, a nephrologist. So you meet with a lot of people, and if we feel that the patient is really not, the donor is really not trying to donate, and they're kind of tepid about it, or then we talk to them about it, and we help them make the best decision possible for them.
Yeah, that's great to remember as well. Very good. Excuse me. So to kind of recap a little bit here, we've obviously talked a lot about transplant in general and the benefits to living donation, as well as what people can sort of expect as they go through that process or start that process. If there are people watching today who are interested in possibly being evaluated as a potential living donor, or they just want to know more about living donation, where can they go to find some additional information or to talk to someone?
They can contact us directly. That would be one way to do it. We at our we have a questionnaire online at our main page. The other thing is you say word Google, so you can Google the National Kidney NKF living donor, and there's they have the big ask, the big give, and that also has a lot of information on transplantation. The National Kidney Registry, they also have a website. If you just put in National Kidney Registry, that they talk about living donation there. And there's also another website, if you Google transplant coach, that you can also get quite a bit of information from. And I believe Lisa our team will put out our contact info or on Facebook after this, so they can certainly contact us and see what's available.
Great. Yeah, great reminder. I believe that we are going to have some things posted in the comments below this video, which are links to some helpful information, as well as the brochure that I mentioned, which features Kenneth Hunter. And he is a recipient of a living donor transplant. We had hoped he would be here to join us today, but he did have something come up which prevented him from doing that. But we thank him for being willing, and he has a wonderful story that I encourage you all to read, because it showcases a way that you can really find a living donor. Kenneth was able to find a donor in one of his former coworkers. As I understand it, it's not someone he had daily interaction with anymore, but he used his resources and sent an email to a large group associated with his former employer, and had a couple of people come forward, including the person who ended up donating to him. So, and
he's probably surprised that this actually happened,
Yeah.
I'm going to show this. I don't know if this will work, but for those who have an iPhone, or if you have a QR code reader, if you're watching this, you can certainly take a picture of this, and it will open up a code to all those living donor, to a PDF with all our living donor links. So I'll just hold it one more time. Hopefully that will work.
Cool. All right. I think this is a little bit of a bonus question, Dr. Thomas, but as it is something that's really relevant today, could you talk a little bit about the COVID vaccine and sort of what that means or implications for transplant recipients and maybe even for living donors?
Right. So you should first discuss with your primary care physician or your transplant center about the vaccine. So certainly that is one thing definitely to do. For patients to get transplanted, okay, the risk of dying from COVID, obviously we all know is very high. The risk of getting COVID is very high, and getting very sick is there. So the vaccine is an mRNA vaccine, the ones that we are using now from the two companies. That it does not have any actual virus in it, so we would consider it not a live vaccine. So transplant patients can get that vaccine. There is a debate about how long you should wait. The official recommendation is that if you get a transplant today, you have to wait at least a month to get the vaccination. There is debate in this area, so ask your own healthcare team about that to be more specific. But yes, so we are, and the other thing is to know how your state is rolling it out. So in the DC, Maryland, Virginia area, you can sign up for alerts and such. But basically, the way it looks, the stages are going, I anticipate that that kidney transplant patients, so they will be able to get a vaccination more likely sometime late January or in the month of February. So they're in the next phase, let's say, of the rollout. Now, if you're preparing for a living donor, obviously a potential living donor they can get the vaccine there, when their time comes on the rollout, or if they're a healthcare worker or whatever it may be. That's also an important point, because the rollout is not just for frontline workers are considered as teachers, people that work in the custodial areas, even the grocery workers and such. So it's not only healthcare workers that are considered in the early phases. So so make sure you check your state's requirements, and you might actually fit in. It might be considering what your job is. If you get the vaccination prior to transplant, so you're going for transplant. So the minimum amount of time is 2 weeks prior to transplant that you can get vaccinated. But I would discuss this with your transplant team, because there is a potential that it can change how we match your match works for your donor. So that's one thing to consider. But if you get vaccinated prior to transplant, that would be ideal. And afterwards, we usually wait a month. And it is, so to our knowledge, of course, there are potential complications of these vaccines, but it has been, it should be safe in transplant patients. Most of the side effects have been fatigue, headache, things that last 1 to 2 days. And I think I would probably recommend, if for any of our transplant patients, once you get the vaccination, probably to check labs, within a week's time afterwards.
Okay. Yeah, thank you for talking about that. I know that was not really related to this topic, but I think it's just so important for those who are watching, and probably something that everyone is wondering about right now. So thank you for answering that.
Yeah, the main point is if you're going to get a transplant and you come up for vaccination, if you're on dialysis, you cannot, if your living donor transplant is scheduled within 2 weeks, you cannot get the vaccination. So it has to be scheduled further out than that.
Okay, good to know. Well, we've covered quite a bit of information today already, related to living donation, related to how to find a living donor, even the COVID vaccine. But Sarah, can we check to see whether we have any additional questions that have come in from our live viewers?
Yeah, we've gotten a lot of good questions. Thank you for asking them and for tuning in again. Our first question is from Zarmina, and she asked, is the delayed kidney function an indication of earlier rejection later, or there is no connection?
I guess I have to answer that one. So,
yes, please.
Alex knows enough about transplants. She can also answer that. But so delayed graft function, the definition of that is you need dialysis within the first 1 or 2 weeks after transplant. That's what that means. That's the strict definition of it. Doesn't mean rejection or whatever. So usually people that need dialysis after the transplant, immediately after, it's not rejection. It's that kidney might be from an older donor, or the kidney had to travel for a long time, so it doesn't pick up right away. It needs some time to quote unquote wake up. So we band-aid that with dialysis until it wakes up. So what happens is a week later, 10 days later, 14 days later, the patient starts making more and more urine, and the kidney function picks up, and they come off dialysis. So it does not mean that you have early rejection if your kidney doesn't work right away. Of course, if the kidney doesn't pick up and we start questioning things, that would be part of our what we call differential diagnosis. But far and away, the majority of time is usually one of those factors where the donor was from far away and we had to fly it in and took a long time to get into you, or or the kidney was from an older individual, or maybe there's another thing when patients pass away, they donate after cardiac death, so the patient's heart has stopped. So those kidneys also tend to have some delayed graft function. So it's more of that than rejection.
Got it. Thank you for clearing that up. Our next question is from Edith. Thank you, Edith, for your question. She asked, do you see less donations due to COVID? I know you kind of talked about that a little bit, but I want to go over that again.
Yeah, thank you. That's a great question. I don't know. We still did 100 something donors last year. So we stopped the program for a little bit maybe, but we really were very careful, and we still did quite a large number. So that's, I think, our second or third year in a row that we did 100 plus living donors. I don't have the actual numbers for you, so maybe there are less people that did come in, but it was not a dramatic drop off.
Yeah, and Dr. Thomas, correct me if I'm wrong, while we maybe paused the living donation portion for a bit, just out of caution, we never stopped transplanting patients, right?
No, we did, right. So we did over 300 kidney transplants last year. I remember that includes liver kidney transplants. We also do simultaneous pancreas kidney transplants, as well as the kidney by itself, living donor or deceased donors.
Great, thank you. Our next question is from Regina, and she asks, can smokers be a living donor?
So we do ask smokers to quit smoking and show us that they really want to quit. Smoking, the issue, of course, is it can lead to cardiovascular disease and et cetera. So no, if you're actively smoking, we tend not to take that person as a donor, but we work with them to say, can we help you quit smoking for your own sake? And that's number one, is your priority. But then number two, if you can do this and show us that you quit, then you can become a living donor candidate. And of course, we examine them extensively to make sure they have no significant heart disease or peripheral vascular disease. So it's not an absolute contraindication. We would have to work with them to get them to quit smoking, and then they could be considered for donation.
Great. Okay. Thank you. Our next question is from Annie, and she asked, how many people can get tested? I assume this means tested to be your donor.
Many as you get. So the easy answer is you tell everybody to do the questionnaire. The questionnaire will weed out certain people, obviously, right? And then when we look at it with our eyes, we say, okay, these individuals will be the better patients to move forward with than this group of patients, let's say. And then depending on the insurance, sometimes you only test one person at a time, and they can do some blood work at a time. But yes, so in general, we say is whoever comes forward. We will basically break down that group to the people that are the best candidates for the patient, and that are the most likely to end up being living donors. And then from there, we go forward with the testing. But so there, I would not put a number on it, but we might work on one person with all the testing at a time, like if as opposed to putting 5 people through the whole gamut at once. But if they're ruled out for some reason, then we'll move on to the next person.
Right.
So bring in as many as you can find, huh?
I would say in general, the more
Right.
Great. Our next question is from Lisa, and she asked, if you are stage 3, how soon should you look for a potential donor?
So take a step back. What Lisa's talking about, great question. She's talking about what we call CKD, or chronic kidney disease, has 5 stages roughly. Stage 5 is when you're on dialysis. So that's when we say your kidney function is 15% or less. Stage 1 is essentially normal kidney function, so your function is 90% or more. Stage 3 falls in the middle. And to make it simple, your kidney function can be anywhere between 30 and 60%. Remember, I told you can only get listed when you're 20%. So if your kidney disease is stage 3, the question is to find out what your number actually is. So when you're close to 30%, we usually start educating patients on, hey, look, you don't need to start dialysis now and you're far away from it, but in the next 5 years, the next 10 years, you might have to consider these things. So usually when the patient's kidney function is right when they're transitioning from chronic kidney disease stage 3, which is that 30 to 60%, to stage 4, which is 15 to 30%. So once let's pick 30%, you can start looking and you can start asking. But remember, we don't transplant you until you're 20% or less. And even the other thing is, if you have a living donor, even if you're 20%, we might hold off because we want to get every drop of urine out of your own kidneys. So some patients, we have the living donor set, we have the recipient set, and we actually wait several months to a year or 2 years, however, to make sure we can use that kidney as long as we can. So then we put the transplant in.
Got it. Okay. And our next question's from Brandy. How long does it take to find out if you are eligible to donate to someone? I think you also touched on this a little bit earlier as well, but I think that's good information to go over.
So we go through the questionnaire and that part. So usually we respond, I would say, within 2 weeks from the questionnaire. So I would say 2 to 3 weeks, and then we bring a patient in for a visit, get all the testing done. So probably I would say, Alex, I think I would say within a month's time. And of course, if it's a recipient in really bad situation or dire situation, let's say they're dialysis access, they don't have anywhere to dialyze them anymore, and it's super emergent that we get the living donor faster, we can expedite a patient's work, that group's workup. But I would say roughly less than a month.
Okay. Our next question is from Lisa. Does my donor have to be a match?
So let's say I needed a kidney and Alex was going to give me her kidney because she likes me so much. So Alex going to give me her kidney, that's when we have to be a match. So if she's going to give me the kidney directly to me. Now, the reason that we try to not say like I have to go find my match is because we have the National Kidney Registry Paired Donor Kidney Exchange Program. The advantage of that is let's just get a living donor for you. So me and Alex are not a match, but Alex still wants to donate. So then we put ourselves into this registry and we find another couple like us who don't match, but you know what? That person matches me and Alex matches their kidney. And they can go into that and do the exchange. Now you've helped somebody else. So me and someone else got helped, as well as more people that are not get to move up the list in a sense. But if you want to donate only to that specific person, that's when you have to be a match. But we really push for that paired donor exchange program and try to have patients be okay with doing that. And it's okay if you're not. Some patients aren't. They only want to donate to their person.
Right.
Okay. So sorry, Sarah. Dr. Thomas, when you say that patients should not include their blood type when they're looking for a living donor, that's because they could be ruling out potential donors who might be interested in a swap like that. Okay.
Exactly. Because first of all, you might not know your blood type. You might not know your blood type. You might be told that you might have wrong information about what your blood type is. So we've tested people and they said, I'm type this, and you're this type actually. I don't know where you heard this one from. So that's why it can lead to a lot of misinformation. And very important, like you said, Alex, it actually will eliminate people that will be, oh, I'm not that blood type.
Sure.
And but there are more complexities. For instance, if the patient is the AB, that means they're the universal recipient. It doesn't matter what the donor is. They can pretty much get the kidney from anybody's blood type. On the other hand, if you're like me, I'm a blood type O, I can really only get a kidney from someone who is a O blood type. So that's why it's complicated as much as saying like, this is my blood type. So that's why I asked patients not to use it and let us figure it out for them.
Yeah. Don't limit yourself.
Yeah, we're getting some great questions. So thank you again, everyone, for asking them. A couple more. Edith asks, this is a two-parter. The first part is, how are kidneys allocated in the DC area, MedStar or George Washington? And then second part is, will you accept testing and blood results for potential donors from other centers like Hopkins?
So Alex, you want to take the one about accepting from other centers? You probably know more than I do.
Gosh, I'll take a stab at it. I'm probably not the best person, but I believe that we will, right? I mean,
Yes.
if it's recent testing, maybe within a year, then we can certainly accept that. We don't want to put someone through additional testing if it's not necessary.
Right. So we will call the center. We'll get whatever necessary information. So we'll try to avoid duplicating tests. Some tests you have to do again, like certain labs. But yes, we can take labs or test results from another center and use them. Allocation, living donor, remember, is not allocated because that's this deceased donor kidneys are the ones that quote unquote are allocated, or you get on the list and they give you a phone call at 2 a.m. to come get a kidney. Recently, the allocation system changed. It is now basically this certain 250-mile radius around wherever the donor passes away from. All those centers are eligible. So and then certain centers get more points that are closer or farther away. So in DC, it's not only which center gets the kidney, right? So it's also how aggressive a center is. So typically larger programs like Georgetown are more used to and more aggressive with getting their patients transplanted. It doesn't mean that we necessarily will say we use a lower quality kidney per se, but we look at all the numbers and we make sure that we're very accustomed to using these kidneys and getting our patients to have good outcomes with them. So, and remember, again, allocation is for deceased donors. That recently changed in the last month. And then living donors, of course, they go to whichever one, whoever their person is. Sorry.
Okay, great, thank you. And our last question is from Rosalind. She asks, how does it work to have living kidney donor transplant with someone who is listed to have a kidney pancreas transplant?
So if someone comes forward and we say they're a candidate for a simultaneous kidney pancreas transplant and they have a living donor, what we'll do is we'll actually have them we'll have the living donor donate. So we'll do the kidney transplant first. So it's January, right? So we'll schedule a transplant, we'll do it. So their kidney is functioning, they're doing really well. Within about a 3 to 6 month period, we will make sure they're active on the pancreas list. So what they'll get is, within a year usually, a pancreas after kidney transplant. So they'll get the living donor kidney, that as soon as they can get that transplanted, and then afterwards, after they're stable and doing well, and the team decides, we will put them on the pancreas list, and they will get a pancreas after kidney. So in the end of it, they will get the same thing. They'll have a pancreas transplant and a kidney transplant.
Okay, great. Thank you. Yeah, like I said earlier, thank you. Those were great questions. We appreciate them.
Thank you so much, and thanks, Sarah, for monitoring those and for reading those. I think I just want to review that if there are people who have additional questions, or if they want to hear more about kidney transplant or about living donation, remember to click the links that are going to be in the comments below this video. There's some really excellent resources there. And if you're interested in being sort of around other people who have gone through a transplant or who have donated, if you're interested in talking to them and hearing their personal stories, MedStar Georgetown does offer a transplant support group every month. So anyone who has a connection to transplant is more than welcome and is encouraged to attend that. Of course, it's also virtual right now. So please reach out to us and ask for some more information about that. We'd love to have you there. With that, I think we are all done. So again, thank you all for tuning in and for joining us here live on Facebook to talk about transplant and living donation. Thank you again to Dr. Beje Thomas for joining us and being our transplant expert. And thanks to Sarah Ridenauer for helping us to get this out to you all.
Thank you, Sarah. Thank you for moderating, Alex.